Hi, my name is Josh Beckman. I am a vascular medicine specialist, and I work at Brigham and Women's Hospital. And I'm here with...
My name is Mark Creager. I'm also a vascular medicine specialist, and I'm in the cardiovascular division at Brigham and Women's Hospital also.
So today, I wanted to speak to you because you've had a long tenure working with a variety of organizations who have been interested in the care of the vascular patient. And in fact, I'd say there was a pretty large set of people who were committed to improve vascular care. So what I wanted to ask you first was, why do you think, despite this army of people and organizations, we haven't broken through to the general population like some of the other diseases have, like cancer, for example?
Well, I'm not so sure we haven't broken through. In fact, in recent years, there's been much more awareness about vascular disease. And we need to define vascular disease, of course. So the public and patients in particular who are experiencing some vascular disease, particularly coronary artery disease, are well aware of that manifestation of vascular disease. I think what you're really implying, why don't they understand or are aware of other forms of vascular disease, such as peripheral artery disease or carotid artery disease?
Right.
I think the awareness is increasing. Although we have done surveys and have published them in recent years and found that general population awareness is low, in the recent years I think it's increased, and it's done so for a variety of reasons. One is that there have been organizations that have gone out and done public awareness messages that have certainly alerted the population to this. But at the same time, industry has been going directly to the public because of newer medications and using terms such as PAD or an acronym when they say the word PAD, I'm not particularly fond of, but individuals out there are more aware of the diagnosis of PAD. But we have a long way to go.
So one of the things I was watching over the weekend was football. And there were a couple of football games, I think the one on Sunday night, where the refs were using pink penalty flags, and the players were wearing both pink socks and pink gloves. And they were doing it because this month is Breast Cancer Awareness Month. I would have to say that if I had to pick one sport where you would have a large concentration of, say, men with peripheral artery disease, it would be football. And it was amazing to me that they were that breast cancer was able to get that kind of endorsement from a major sport. I'm wondering if you think that one of the things we haven't done well is to mobilize the patients so that they push forward the science, the advocacy, and the care. And what ways would you think that we could do that?
Well, it's also a very good question. And everyone is wearing pink now to increase breast cancer awareness and in support of Komen for the Cure organization, and they have done a wonderful job in getting the message out. And it's a very compassionate issue for people affected by it and by their families. But people don't realize that atherosclerosis in general is much more prevalent, and the #1 cause of death in the United States is coronary artery disease. And of course, many of the individuals listening to this interview know that peripheral artery disease is a manifestation of atherosclerosis, and many of these people have coronary artery disease. But the message is not as compelling. We haven't been able to get to the public and really underscore the importance of the risk factors for atherosclerosis, the consequences of atherosclerosis, including coronary disease, including stroke, and notably peripheral artery disease. And we haven't gotten the message out that when you have peripheral artery disease, you're at high risk for myocardial infarction and stroke. So how do we do that? It has to be a multi-pronged approach. We have to go directly to the public, but we also have to utilize governmental agencies and other foundations to make legislators more aware of it, to make people in other organizations more aware of it, and to really inform the public.
One of the things I like about VIVA is that it's a multidisciplinary organization, and it can bring together a wide group of people who normally wouldn't work in common cause. I am really worried that over time, we're going to have difficulty mobilizing the public enforced for these disease processes. October itself has 11 separate things, 11 separate medical problems for which it's commemorated. And so there's a lot of noise about each disease process. And so I wonder if you think we've sort of hit the limit of the number of things the public can pay attention to. And if that's not the case, and I hope it's not the case, which organizations do you think should be reaching out to the public to try and form partnerships to move forward awareness and action?
Again, I'm not so sure that the public is unaware of diseases, vascular diseases, and we're focusing on peripheral artery disease, but they need to be made more aware. I don't think the problem is that we have disparate vascular disciplines all taking part in the care of patients with vascular disease. We're all on the same page. We're all aiming in the same direction. We all want to improve awareness and make sure that our patients are getting appropriate preventive and therapeutic measures. However, there are organizations that are taking steps, and perhaps not well aware to everyone, but I'll emphasize the American Heart Association. And I'm very much involved in the American Heart Association, and through a number of efforts, approaching the public through direct campaigns, through advocacy, are making individuals much more aware of atherosclerosis and its consequences, and that of course includes peripheral artery disease.
I think one of the things the Heart Association has done incredibly well is to sponsor the Heart Walks. Heart Walks in all the different cities across the United States harness thousands of people on a single day in multiple places across the United States, and I think raise awareness. One thing I wondered is if a group like the Heart Association, who has been really good at improving public health, would want to either have more walks or broaden the topic or do something to help in those walks broaden the understanding of atherosclerosis.
So organizations like the American Heart Association have a number of activities which not only raise awareness, but bring in revenue to support programs. But it's really the programs that the AHA has, among other organizations, that go directly to the public. And if I can speak for the American Heart Association, one terrific program has been the Go Red program, which has really done a tremendous job in raising awareness of heart disease among women who really heretofore really didn't think that they were as much at risk as men in developing heart disease, and it's done a remarkable job. And the AHA has also done comparable work with their programs for stroke. So, and stroke is another excellent example where the public really wasn't that well aware of its prevalence and its devastating consequences, but through programs such as those of the AHA, they're doing so. Now, PAD really hasn't risen to that same level yet, and I can't say that there will be a program coming forth, but through organizations, not only the American Heart Association, but a number of the vascular specialty organizations that are represented at VIVA, certainly steps can be taken to improve public awareness.
All right, so I want to move on to one other topic that maybe we can cover in the last few minutes. You've been involved in understanding the causes of vascular disease now for several decades, really been a leader in this research field. Where do you see over the next decade the research leading? What are the next great horizons you think we're going to be conquering?
Well, obviously it's a broad question, and there's tremendous and very innovative research going on in many spheres in vascular disease. Our understanding of the pathogenesis and pathophysiology of vascular disease, its epidemiology, its genetics, all the way through to therapeutics. And that includes pharmacotherapy, cell-based therapies, and certainly the advances in the technology contributing to improved therapies for revascularization. So I think it's going to be an attack on all fronts. I'm most excited about the promise of genetics and genomics in increasing our understanding of who's at risk for atherosclerosis so we can target and focus our attention on maybe particular individuals. I think our understanding of what causes peripheral artery disease and what causes the manifestations of peripheral artery disease will increase dramatically. I'm very excited about the potential for novel therapies, particularly as we understand more about cell-based therapies to improve symptoms and outcomes in patients with severe peripheral artery disease. And I think there is tremendous promise as we go, as we're developing more novel devices to provide adequate revascularization that is durable and sustained.
If you were to tell a junior person why now is the time to get into vascular medicine, what would you tell them?
There's many reasons to get involved in vascular medicine. So just to follow the research question, there are research opportunities. So if someone is academically inclined to pursue research, all these areas I spoke about are opening to creative, innovative, enthusiastic, energetic individuals to really get involved in the most fundamental areas of scientific research, to translation, to outcome. But more than that, there is opportunities for those individuals who want to take care of patients with vascular disease. So few clinicians, as you're well aware and have implied, really understand vascular disease and how important it is to have a comprehensive understanding of vascular disease. And the knowledge of that just enables someone to really provide a comprehensive approach to many, many patients. And with innovative therapies coming down the pike, the excitement is just going to be continued.
Well, I want to say thank you very much, both for coming to the meeting and to speaking with me today. This is Josh Beckman signing off. Thanks very much.